Good morning. My name is Ralf Friedrichs. I am an author, an addiction recovery coach, a life coach, and the host of this show, the Take Your Life Back Today radio show. Also on the YouTube version on channel Take Your Life Back Today show. Deaths in the United States are on the rise from alcohol, drugs, and suicide. They've hit the highest level since records started being kept. The number of deaths from alcohol, drugs, and suicide in 2017 hit the highest level since federal data collection started in 1999, according to the analysis of the CDC, which is Disease Control Center, and prevention data by two public health nonprofits. The national rate for deaths from alcohol and drugs and suicide rose from 43% to 46 deaths per 100,000 people in 2017, a 6% increase. That was a slower increase than the previous 2 years, but it was greater than 4% average annual increase since 1999. Deaths from suicides rose from 13.9 to 14.5 deaths per 100,000, a 4% increase. That was double the average annual pace over the previous decade. Suicide by suffocation increased by 42% from 2008 to 2017. Suicide by firearm by 22%. My friends, it is getting to a point where it is uncontrollable. It's almost a joke how simple we're trying to make these issues disappear, he says. We're not changing direction. It's getting worse day by day, no matter how much awareness we bring. So here are some approaches. We need more funding and support for programs that reduce the risk factors and promote resilience in children, families, and communities. Trauma and adverse childhood experiences such as incarcerated parents or exposure to domestic violence increase the risk of drug and alcohol abuse and suicide. Policies that limit people access to the means of suicide, such as safe storage of medications and firearms, and responsible opiate prescribing practices are needed. Also needed more resources for programs that reduce the risk of addiction and overdose, especially in the areas among people most affected and equal access to such services. While overdose antidotes and treatment for opiate use disorder are needed, this doctor says it's not going to fix the underlying problems that lead people to end their lives, whether or not it's intentional or not. In most states, deaths from alcohol, drugs, and suicides increased in 2017. In 5 states, Massachusetts, Oklahoma, Rhode Island, Utah, and Wyoming, those deaths fell. Deaths from synthetic opioids, including narcotic pain reliever fentanyl, rose 45%. Such deaths have increased in 5 years. Folks, it is out of control. We need to bring more awareness, but we need more funding and more programs. Give me a call at 844-405-HELP. Together we can help each other prevent some of these overdoses and suicide deaths. May God bless each and every one, and let's bring more awareness to this terrible epidemic that